What is sleep apnea? Do you snore loudly or wake up often during the night, sometimes with a gasp or a snort? It might be sleep apnea, a common disorder in which you have one or more pauses or shallow breaths during sleep. The breathing pauses can last anywhere from a few seconds to minutes and can occur 30 to 50 times an hour. When that happens, of course you sleep poorly, and it can make you feel very tired during the day. A lot of people suffer from sleep apnea for years without even realizing it. The most common type of sleep apnea is called obstructive sleep apnea, which is caused by the airway collapsing or becoming blocked during sleep. That blockage is what leads to the breathing pauses or shallow breaths. As air tries to squeeze through the obstructed airway, it often causes loud snoring, snorts, or gasps. When you sleep, it's normal for your throat muscles to relax. Sleep apnea occurs if those muscles relax too much. It can happen if your tongue or tonsils are large, causing your airway to be crowded. It can also occur if the shape of your head and neck causes a smaller airway size. More than half of people with sleep apnea are overweight. The excess tissue in the throat and neck can thicken the wall of your windpipe, making blockages more likely. Aging can also be a risk factor, especially for women. You may not be aware that you have sleep apnea, but there are signs and symptoms. These include a loud chronic snoring, waking up choking or gasping, feeling sleepy and having low energy during the day, falling asleep or needing a nap throughout the day, and waking up in the morning with a headache. Many people with sleep apnea also have high blood pressure, diabetes, and have excess weight around their middle. If you or your doctor think you have sleep apnea, you need to get it diagnosed. So, how do we diagnose sleep apnea? Well, at the Temple Sleep Center, we have full diagnostic services. We do studies both at home and in our fully equipped sleep lab. These include keeping a sleep diary, taking a history of your sleep habits, and a physical exam. Sleep studies, including a test called a polysomnogram or PSG. This records brain activity, the amount of oxygen in your blood, and whether or not you stop breathing or pause while you sleep. Watch our sleep apnea treatment video to learn more. To schedule an appointment with a Temple Lung Center physician, call 1-800-TEMPLE-MED.